Aloha. My name is David Isei, and I'm the Executive Director of the Hawaiʻi Healthcare Task Force. Today, I want to talk about something that affects every person in Hawaii, whether you see a doctor often or only when you absolutely have to. It's called the Primary Care Protection Act. Primary care is the front door of our healthcare system. It's where chronic disease is managed, where problems are caught early, where long-term relationships between patients and providers are built. But here in Hawaii, that front door is broken. We face a severe shortage of primary care providers, especially in rural and neighbor island communities. Clinics are closing, doctors are retiring early or leaving the state, and patients are waiting longer and longer to be seen. This isn't because providers don't want to serve Hawaii. It's because the system has become financially and administratively unsustainable. Today, insurance companies spend the majority of healthcare dollars after people get sick on hospitals, emergency care, and specialty services. Meanwhile, primary care, the very foundation that keeps people healthy, remains underfunded and overregulated. Providers are routinely subjected to practices such as downcoding, in which payments are retroactively reduced, excessive prior authorization for routine care, and payment delays that can stretch on for months. All of this pulls time, energy, and resources away from patients and pushes providers out of the system altogether. The Primary Care Protection Act is designed to change that. First, it requires insurance carriers to invest at least 12% of their medical spending directly in primary care, paid to the providers actually delivering care, not siphoned off by middlemen or buried in administrative overhead. Second, it safeguards providers from harmful insurance practices that delay care, undermine clinical judgment, and threaten the financial stability of primary care practices. And third, it restores balance to our healthcare system by recognizing a simple truth. When primary care is strong, patients are healthier, costs are lower, and communities thrive. This act isn't about politics. It's about access. It's about sustainability. And it's about making sure that every person in Hawaii has a front door to healthcare that actually works. Protect primary care, and we protect Hawaii.